I want to thank all of you for joining me. This is supposed to be like a 30-40-minute session followed by a Q&A if there are any questions. My name's Dr. Williams, aka Queen, and I'll go through some information in a little bit. But I want to honor everyone's time, and it is now 1900 hours, 7 p.m. So I want to go ahead and get started really quickly. There are, over to the side, I see some of you already find the chat. Please go ahead, you can chat there. But the biggest thing is a Q&A as I go through this. If you think of a question to ask, you just put it there. And when I come across in the end, I'll use some time to answer your questions. So I'm going to try to share my screen and prayerfully we'll be good to go. All right, so here goes. Let me share my screen here. Let's go ahead and get started here. So today, we're going to be talking about the VA medical disability review process and just cracking the code of your medical records, right? As I said before, my name is Dr. Williams, aka Queen. I was both enlisted and I am retired, Lieutenant Colonel, about 4 years now. The reason why I'm doing this is because, well, when I was enlisted, I do not recall ever going through the disability process. I don't remember being told about that. And when I was retiring as a lieutenant colonel, I'm also a physician. And some of the things I went through. So I'm just going to jump into this and I'll tell you stories as I go along because I really want to wrap this up within the hour as promised. I don't want to go over that. So let's see what we could do here. All right. So let's go to the next screen here. Again, this is a VA Medical Disability Review. This is in collaboration with Queen Quanta, with New Life, my church, whom I promised I would do this back in last November. And so finally getting around to it, doing it. And with QuantaKUW, who is a nonprofit who is actually providing this platform and helping us to do this information session. Even though I am retired, I want to be able to continue to serve those who have served or those who are still serving. And there are a lot of information out there for you that you are just not able to access because you don't know. And I don't believe the hype that what you don't know won't hurt you. That is absolutely not true. You need to know what's going on. And that's what this is all about. Just educating you and hoping you can share this with others as well to make your process, whether you're out or active duty, so that you can benefit from having served. So this is my disclaimer, right? I do not represent the VA. I do not represent the Veteran Administration in any way. I am not a VSO. I am not a veteran service officer. I am not a lawyer or other credentialed personnel who works with the VA for disability benefit. This is not a step-by-step VA disability form process. This is supported by QuantaKUW.org, which is a nonprofit 501c3, and they promote a lot of free educational info. So, of course, there'll be an opportunity for you to donate to them if you would like to do that. I am myself a veteran. I have 2 DD Form 214, and I'm also a medical doctor. I have to let you know also in this disclaimer that my primary practice, the thing that I do is cancer. I'm a cancer doctor. I treat cancer with radiation. And so this is not my forte. What I'm speaking from really is from my personal experience. And I was so chagrined by my personal experience and process that I wanted to share it with you. So I'm providing this service free of cost, but we believe in this mission. And so that's why I wanted to do this, because I was just appalled. So anyway, I just wanted to be able to share this information with you because I believe that you can benefit from this knowledge. No sense in me sitting on it when you can benefit from what I have learned, right? So here goes. If you're active duty, right? Preparation is key. But if you're active duty, if you are sick, please, 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 please go to sick call. If you've twisted your ankle, you have a cold, you're coughing, your eyes are hurting, your tummy's hurting, you go to sick call and let them tell you you're not sick. Do not be guilted into not going to sick call. Go to sick call. If you're ill, take care of yourself. And remember, if it's not documented, it didn't happen. Veterans, go through your own records, right? Do not just depend on the VSO and on the VA. Get your own records and go through it. And this is what this is about. I'll give you a few tips here and there about what to do in handling going through your record. And I've been thinking about doing this since November, but timing is key because there's been a recent reveal on March 5th, which is big change for millions of veterans, and I am so excited about it. How to peruse your medical records by organ system is the last thing that we will cover. So let's go find out about this big news that came out. You probably already know about it. Hot off the press, effective March 5th. This year, 2024, the big change, the PACT Act. If you have not heard about the PACT Act or don't know what it's about, this is something that can benefit you if you're not receiving any sort of VA benefit or if you have minimal VA benefit. This is something that you can definitely benefit from. So I know that you can read here, but I just wanted to go through it, that how important this is. The VA announced that all veterans who are exposed to toxin and other hazards while serving in the military, at home or abroad, are now eligible to enroll directly in the VA healthcare. This means that all veterans who served, regardless of what the time frame was, the Vietnam War, Gulf War, Iraq, Afghanistan, the global war on terror, or any other combat zone after 9/11, are eligible to enroll in the VA healthcare without first applying for the VA benefit. What's totally different about this VA is now that this include in active duty training. In other words, Guard, right? The National Guard, if you're in the reserve on drill weekend, let's say you joined, but you never really was called to duty or you weren't able to go on duty, but let's say you were training at somewhere I trained in Alabama and you're exposed to toxins on the job during drill weekends, you're in. This is your ticket in, and you don't have to go through the whole benefits process. And I'll go through this a little bit more with you to provide some more information. Okay. So for example, I knew when I went through my enlisted training, I was at Fort McClellan in Alabama, and we did OSUT. I know MP trains there and NBC. I was nuclear, biological, and chemical warfare specialist, you know, that gas stuff. And the city around Fort McClellan, they received a compensation. And the folks who were on Fort McClellan, they were told, oh, it's on the congressman's desk. Well, if you are at Camp Lejeune, Fort McClellan, any of those places, you are now eligible. And this is so exciting for all my brothers and sisters who are serving in the reserve or Guard. So I'll have more information on this. So what were you exposed to? There was something talking about the tanks that were made with lead or certain toxins. So if you were in field artillery or work in a tank or anything like that, there may be some exposure associated with that because they were made with, I think, depleted uranium. So that is very important. And this was my fun gig. I was in here in a tank. Lord knows what else I was exposed to. But doing my very fun NBC thing here and just hanging out with a good buddy. Yeah, you don't look cute when you come out of chamber stuff like yes. You take your mask off, you're a hot mess, just snot everywhere. Beautiful. But it was fun. Anyway, what were you exposed to? Do you even know? And a lot of people were stationed at different places and they're in their own world right now. They have no idea about what this is all about or that they were possibly exposed to things. I'm going to stop right here and just do a quick poll survey here, if you will oblige me. I'll be interested to know why, if you're a veteran, you did not go through the disability process. And remember, this disability process stuff is not only about you. So this is for your family as well. Okay. So now I have an idea of the population serving. Let's go through some of this information here. What exactly does the PACT Act covers? There are 3 areas that it's broken down into. First one is wars in operation. You get to decide based on the time that you serve where you best fit. For the wars and operations as listed here, you have Operation Enduring Freedom, Iraqi War, the Gulf War, and they give you a date and the time, right? And remember now, this also covered those who were at home, right? So the World War was in 39 to 1945. If it doesn't matter your age or when you serve, if it's even 2 years, remember your spouse can benefit from this as well. And if there is someone whose spouse had served but is now deceased and this covers them, there is a way that they can also benefit from this. So there's a lot there that's going on in this PACT Act. Exposure categories. The chemical agents, like I said, radiation, nuclear, if you were at Camp Lejeune with the water supplies, if you were at Fort McClellan, radiation, nuclear weapons, if you serve on the ship and you were on any nuclear ship that you had nuclear weapon on that ship, you were eligible for something, okay? Air pollutant, burn pit, smoke, dust, sulfur fire, occupational hazard, asbestos, lead, vibration, and noise. A lot of time, I'm glad I said that, the noise portion. So when I was enlisted, I was stationed at the out in Colorado Springs at the 4th ID. It's amazing. We really never forget that, right? The Mechanized Infantry Division. And I was with the 329 Field Artillery. Field Artillery, you know what they do. They're lobbying and launching stuff downrange all the time. So in the 90s, did they have the appropriate earplugs and stuff? Absolutely not. And also, I think there's something saying there's an automatic 10% if there are any hearing issues, because those orange flange that we usually use, they were found to be defective. I don't think that was publicized. So hopefully you realize any sort of noise, if you're in the Air Force and you work, what do you call that? Where the planes take off and stuff, you're exposed to noise, that is also a benefit. And a lot of these things don't have to be documented, right? So that's important to know. So go back, take the PACT Act and what it covers, and then look at where you were stationed. And I'll tell you the importance of that. The related health concerns that you need to be aware of, right? There's Agent Orange related diseases, Gulf War veteran illnesses, radiation related diseases. Now notice on here, they just put the word diseases and illnesses and did you get a medication? They're not going to go directly into what those related diseases are. Hence, you have to do your homework. There are a lot of diseases that are associated with this that you're just like, well, how do I know what? Look, let me tell you, you may be young and spry and okay now if you're active duty. Age come to some of y'all. It's not coming to me. I rebuke that in Jesus' name. I'm not aging. I'm stuck at 39. I am stuck at 39. Yes, don't try to do the math. Y'all who know me from other time. I'm stuck at 39. Anyway, you have to know some of the traumatic brain injury. When you're out doing PT and y'all playing around and doing rugby or football and you get knocked down and you hit your head, hopefully you went to sick call, because then that covers under traumatic brain injury. Cold injuries, heat injuries. I got a story to tell you about that. Birth defects, infectious. There's so many stuff that is they don't know these things. Bless the hearts of the VSO. But even as a medical person, let me tell you, my husband will tell you, I went to work and I was surprised at some of the things in there, and you'll see for yourself in a minute here. So there's a handout I'll give you. I have an example handout about some of these, but I will send an email after this as well with the link where you can go. Does this increase your rating or is this separate? I think this will increase your rating. Put those stuff in the Q&A so that I don't lose it. I'll go over, because then remember, if you have illnesses that's associated with any of these and you didn't have it before, you weren't rated before, this is something new you can get rated on. But the beauty of the PACT Act, if you were not in the VA health system before, you could just go register. You don't have to go through that belaboring process of proving that this was done and I have. If you fall under any of these SWOR and any of these exposure, you could just sign up. It's as simple as that. Isn't that a beautiful thing? But back to this. So I grew up in Jamaica, right? And if it hit like 70 degrees in Jamaica, everybody putting on leather jacket, they're cold. Like, what? Yeah. So I grew up in Jamaica and I'm used to warm weather. And some of you may laugh about this. They have that little wish list about where would you like to be assigned? Fresh off the boat, I'm like, yeah, can you send me to Texas? I want to go to, New Mexico, all the warm places. My first duty station in America was Colorado. And I'm just like, what is this white thing that comes from heaven? I know I read about it. I'm just being facetious. But I was just like, and then I was with the Field Artillery and those dudes were out there. If you've ever been to the base, the 4th ID Mechanized Infantry, they have something called a tank trail. And you were out there in your boots. And my first sergeant back then believed that you train as you fight. Right? They said, well, if the weather is cold, they're not going to change the weather for you, private. So get out there. So I get out there and I'm doing what I do, right? Because I was all hoo-ah back then. I'm still hoo-ah now, but just kind of down low. So all of a sudden, I couldn't feel my fingers, couldn't feel my toes. Like, what, I take up my fingers. It looks like this thing. I was like, what? What's going on with my fingers? Now, I didn't know initially. I just tried to warm them up. But thank God for Jesus. At some point, I did one of these numbers. Don't just take a picture like that. When I took my picture, I hold my hand up to my face. So yes, this is me. And they could see from my waist up, it is me. And this is my hand. And I'm about to lose my finger. Everything matters. And some of them, if it's not documented, it's okay. And that's the beauty of this act. What does it mean to have a presumptive condition for toxic exposure? This is a little tiny here, but again, I will send you the link so you can read all this stuff for yourself. So what this actually is saying is that you can get your VA disability rating. You must be connected to military service. But for some conditions, we automatically assume or presume that your service caused your condition. We call this presumptive condition. That, my friends, is the cake. You can take that and look, you don't even have to have it in your record. All you have to do is show that you served during that time and you were at Camp Lejeune. I still have my record that show I was at Fort McClellan, Alabama. That's where NBC trained with the military police folks. What things could be wrong from the many vaccinations we were required to do? That's where the list stuff come in. I've not gone in depth yet, but if you had vaccination, you can go back with the link I'm going to send you. It'll be in your email tomorrow, and you could look to see what kind of stuff is associated with this. There's immune disease. Is it diabetes? But that's why you have to do your homework. That's why I'm doing this session, right? So you can have a condition presumptive when it's established by law or regulation. And that's what the PACT Act is. It's now established by law. You have a presumptive diagnosis and they can't turn you down. And if you have a presumptive diagnosis with some of these issues, then it's like doing it in the reverse. First, you get into the VA. And if you're not in, if you're already in, then you can start filing your claim based on manifested illnesses that you're experiencing, right? So you're eligible. So am I eligible for VA healthcare under the PACT Act? You're eligible to enroll now without needing to apply for disability benefit first. That is so beautiful, right? So that's what this is all about, my dear friends. You can now apply. If you serve and you are willing to go and die for this country, then If you have some issues that you develop during that time, then it's yours. It's not a pie, by the way. It's not as though if you get your slice of pie, somebody's going to get less. That's not what it's about, not at all. So apply for your VA healthcare. Let me see if I can move my picture here. Well, it just says apply for your VA healthcare. So you can go here to www.va.gov/health-care. So right in this area here, if you could write that down, you can go there. And if you don't have any VA benefit, you can start applying now. Don't let anybody, even if you are a reserved or you were serving National Guard, don't let other people tell you no. That's one of my little pet peeves, like don't let the leaders or the organization tell you no. So you need to go ahead and apply. So this is what the page will look like. When you go in, you apply for your benefit, gather your information. In this case, you say social security number that you may need, insurance card information, your military service history, because if you're doing a presumptive diagnosis, they're going to want to know, well, where did you go? You want to get a copy of your DD Form 214 because that will list all the places where you've been assigned, right? And then you just click start that application. Let's get it going. You could do this. Use your resources available. So here it tells you that it'll take you about 35 minutes. If you take 35 minutes of your time and you have the possibility of increasing your rate or getting rated, why leave the money on the table? I'm just putting that out there. 35 minutes is worthwhile. And if you're experiencing symptoms, you don't know, maybe some of that gas, or some vaccination you got, or when you hit your head trying to play volleyball or whatever your unit was playing and stuff. Let them tell you no. Presumptive. That's the beautiful word right there. I'm going to stop here and I'm going to put out here. If you could please let me see if I could do this without shutting down. Let's see, offers here. I would like to ask you to please support QuantaKUW. If you can, if you click on that donate here, it'll open in a different link. And at your leisure, if you could donate to this nonprofit who brings this kind of free information to you on a regular basis. Typically, it's in the cancer realm, but I was so excited about doing that. I promised I would do this on Veterans Day last year. And so I really enjoy teaching. Can you tell? And I really enjoy putting information out. And for once, I'm not talking about cancer stuff. By the way, some of these toxins and issues can cause cancer. Agent Orange, prostate cancer. Yes. If you have cancer, it'll be 100% initially, and then over time it may decrease. But I think the minimal in the survivorship mode is like 30% or something like that. So if you have any type of cancer, or if you're a survivor or a spouse and you had someone who had cancer that could have been caused from all these exposure stuff we did, they can also benefit. So again, that's the beauty of this. Not only you, but also the your spouse and significant others can benefit. So why not push through? I'll say thank you again for donating to QuantaKUW, and you'll have additional time to do this later on. All right. So that was a summation for the PACT Act. Now that's new, that just came out. So I haven't delved into that quite yet to see what's all the things that's going on in it and what are the associated diseases or illnesses. So for those who, for example, was Fort McClellan, where I did my OSUT, my one station unit training, I was there for 6 months. And a lot of these things, you only have to be there for like 30 days, I think it is. Again, you'll have a link directly. I'll send it out in your email tomorrow. But that's the first thing. Man, that removes such a huge barrier. And I am just so excited for those who are able to now be able to benefit from this and their spouses. Now, let's get into your medical records. Whoa, okay, good timing here. Your medical record contains all the secrets you know, right? There are no shortcuts. If you serve 5 years, 2 years, 10 years, 20 years, is it not worth going through your medical records for, I don't know, if you do it an hour a day, depends on how long you served, it's worth it, right? You must go through all of your records and your dental too. Don't be fooled. There are dental benefits. So the VA usually don't give the the dental portion, but if you have issues with like the TMJ, or you broke your jaw and now you have problems eating, or you're drooling a lot, or some nerve damage, all of that can also be of benefit. So you want to go through not just your medical record, but also your dental record. And you have some awesome VA assist. You have some awesome VSO, but they're not all created equal. And remember, they're not medical, right? And the people who are going to be examining you, well, they're medical like myself. And let me tell you, when I went through it, I love doing stuff incognito, because I'm kind of laid back. I don't say nothing much. I just do. But then they start saying something. I'm like, oh, hold up now. And I start talking their language. They're like, oh, are you a nurse? It's like, no. Oh, you're a physician? Yes. And what's your specialty? I'm a radiation oncologist. Oh, and they start backpedaling. What are y'all doing to my young soldiers who don't know the medical terminologies or stuff? So that got under my skin so much. My husband was like, girl, calm down. I was like, I'm like, no, stop it. What about dental issues caused by a service-connected disability? Yes, if you don't write it down and you don't ask, you won't know. So if you have a service connect, sometimes people get things like Bell's palsy, which is a nerve issue, but then that nerve issue will cause you not to be able to keep your mouth closed. And so you may have a dry mouth and develop dental caries, right? So it's one thing that led to another thing that led to another thing. If you have proof that, hey, this is what's happening, you got to write it down, but some people just don't know. And that's the beauty of why I was so excited about doing this. Not only did I serve myself as an enlisted, I don't know what I was thinking about here. I was just tired, right? And my wonderful mask, that was my ability. But a lot of those things, the black guy looks like you. Dwight Kenny says that. Yeah, so I'm just saying, you got to know the things. What about conditions you find out after you get out the service? If you find out about, here's the thing. If you're Army, I'm not picking on my Air Force buddy, but y'all used to ride the bike, y'all. I don't know what you're going to injure on the bike. But if you're Army, you have to do that push-up, sit-up, 2-mile run. It was a proven fact that the sit-up hurt your back. That's why they were choosing to change the whole physical PT. Now they're doing a PT stuff like I used to do at West Point Prep, 10 parts to it. I'm like, what? They're really. So if you do have that, then you need to go in and said, yes, I'll get to some of these. Could it happen? What about medical records, years that are missing? There is a medical repository that you can ask for, that you can say, where are my medical records? And that's, if you're active duty, yes, I tell all the folks I know in military, every time you go see the doctor, you need to get a copy of that after visit and scan it, or keep a copy of, you need to see my medical record. And I was enlisted. I wasn't a physician or knew I was going to be a physician then. My stuff is thick because I was athletic. I used to run around. I run with the guide on. I was, I did all sorts of crazy stuff. So let's see here. What's next I have coming up here? Disability rating by system. This is how I recommend you go through your medical records. And you're like, what is this, Queen? I've never seen anything like this before. I know they don't share these things, do they? So the disability rating is done by system. What does that mean? They go through the musculoskeletal system, then the organs of special senses, impairment of auditory, and that's your hearing issues if you have any. Then they look at infectious disease. Some of these things, I know some of you are like, what? How do I know if any of these apply? Or where do I find out about some of these things, right? Hold your horses there for a second. So there are a lot of stuff. So this, when you go in for your medical disability evaluation, this is what they're doing it by. The cardiovascular system, the digestive system. You're like, well, what digestive system? What is that? If you're not medical, it's okay to not know everything. Your digestive system goes from your mouth all the way down through your anus. And there's all the stuff in between. And I'll go through some of the information here in a little bit. I can't go through everything today, but I just want to give you an idea of what it is you need to go through. The GU system, any bladder issue, right? Any neurological and any seizure issue, mental disorder, PTSD, anxiety, depression, all of that stuff makes a difference. So for example, let's go through one of them right now, the musculoskeletal system. Almost everybody's going to have musculoskeletal issues. But the way that they do it is they go from the upper extremities, meaning your arms, your hands, and it makes a difference if you're what hand it is. So if you're right-handed and you have right hand issue, that would rate more. And if you're left-handed and you have left-hand issue, that will also rate more. Lower extremity, the gait, your leg length. You have short legs for some reason. And in neurological impairment, that's sciatica. Spine, any sort of deformity, you hunch over and you have that curvature, that there's also an issue. Muscle atrophy, scars, flare up, and joints and bones. And it's big. There's a lot of stuff you can go through here for the musculoskeletal system. And in most cases, you'd be surprised to know this is the system that people get rated the lowest on because it's so common. So additionally, this stuff is stuff I got off the internet. Nobody gave me any of this, but the thing is, I know what to look for, right? But there are some things you would never dream of that would be in the disability issues. If you have like a rash on your skin, what percentage of your skin do you have this rash? If you have acne issue, if you grow a beard and you have ingrown hair problems, yeah, all of that. But when I saw this, I didn't really laugh, but I turned my head like, I didn't know they had that there too. I was like, what? Loss of use of both buttocks? This does not mean you have a flat booty, y'all. That's not what this means. It's not about having a flat booty. It's loss of use. So if there is some kind of nerve issue and sitting down is a problem and you have to push yourself up, so there's some muscle atrophy of your buttocks, that's not genetic because some folks have big booties, some folks don't. Or should I say buttocks to be medically correct. I encourage you guys to put your questions in the Q&A. I think that will stick. While in the chat, it may go away. So you want to make sure that you go through some of these. I see something about headaches. The thing about headaches, I don't know if I should say this on here. Headaches, it's a frequency. Does it stop you from doing your work? How often do you get it? Do you have to take medication? It's all in how you report it and how your experience is. Remember now, my disclaimer, I'm not encouraging anybody to lie or not tell the truth. But if you're taking medication for a headache, taking medicine for anything kind of changes what it is. And then for your hip, here is how they usually get you for these joint and musculoskeletal rotation. You see how they have all these angles they're showing you here about the flexion and the dorsiflexion of this and how your arm should be able to go out, and they're looking, can you rotate your arm forward or left to right? But this is what you should fare. If you're seeing someone and they start taking out these rulers, they're looking at the angle that you're able to achieve. Are you able to achieve the 90%? How much is it decreased by? They're looking at your shoulder. I have a partially torn rotator cuff. They're not going to do surgery on me for that because I'm right-handed. And it's my right shoulder. So, but they have to bring these geniometers out and measure how far you could bring your shoulder up. And they have to look, if you're bringing your shoulder up and you're wincing like I'm doing here like now, that hurts. Then they have to go to the angle where you don't wince or where it does not hurt. So don't try to like, oh, I'm gonna be tough, and then you're secretly crying and trying to bring it up. No, sweetheart. You have to be truthful about where it hurts and stop. So that's what that's about there. Okay. The respiratory system, if you have asthma, especially we used to have to do all those running in the cold, let me tell you, running in the Colorado cold, fresh off the boat from Jamaica, I thought my lungs were going to explode. They gave us 30 days to acclimatize, and still, it's just like all that breathing in that high altitude area. I do have a limitation on my head because I have pins and left. Oh, no. So again, yeah. So there's a lot of things associated with a lot of rotation, your pain, the surgery. Now, remember, if you have surgery for something, they're saying we fixed it. But maybe you have surgery and they didn't quite fix it. You're still limited in your range of motion. That was a question that came up. So back to respiratory system, right? Asthma, emphysema, COPD, chronic bronchitis. You're always getting that infection and restrictive disease. Gunshot fragments, wounds that cause issue. A lot of folks, if you smoke, some of these may be familiar to you. So you want to be able to go to the doctor and see what's going on. You don't even have to. How is it you're going to have COPD when you retire at 42? If you retire and you're 47, you're not going to have COPD then. But if you have a smoking history. Oh, and I remember when I was in medical school, I did a project. And the topic was marijuana, menace to society or miracle medicine. And they're saying that marijuana was a stepping stone to harder drug use. In my research, I found out that they used to put cigarettes in the MREs or in the C ration, was it called? In the Vietnam days. So they used to put cigarettes in there and they used to encourage, you remember those cigarette breaks they used to give people? So that's something that could be presumed as well. You've been exposed to the toxin of smoking and burn pits and all that other stuff. Again, sleep apnea is big, y'all. If you sleeping and your wife is like, oh, you stop breathing and you need to get evaluated because sleep apnea, if you need a CPAP machine, that's a wrap. You're good. Right? So it could have been something you're exposed to while you're in the military that's affecting this, but you need to get a sleep study done. If you're always having chronic rhinitis stuff, it could be that you were exposed to certain things, ear diseases, laryngitis, the smoking, being exposed to radiation, all that stuff makes a difference. It makes a difference. So you have to go through your record. Now, in all honesty, this is what some of these records look like. And I really can't expect you to read all this. This used to be a combined record from the Vietnam time, but I still have my medical record. Remember these? Right? So you should still have these records available to you. You should have had your own record. I remember I had some great first sergeants. I had some great platoon leaders and sergeants back in the day before I became an officer and a paper pusher, as y'all like to say. But I served my time as enlisted, man, and I learned a lot. And so I kept everything, my orders, my medical records, dental records. So you probably have something that look like these if you're old school. But you should keep it on this fish, this little brown thing that they keep for the repository in, I think it's in St. Louis as well. So you can request for those fish and start going through your records. And you may have to need somebody to decipher some of these or what some of these writings mean and these pointing to the back and all that stuff. But you have to do your work. You have to do your work. Getting near to the end here. Here's some golden nuggets I'm going to leave with you, right? Golden nuggets. You can take a picture of this if you want to. Cardiovascular issues. You're going through your records, you see some of these acronyms, the CAD, coronary artery disease, HTN, hypertension. Did you have a heart attack? They're not going to put heart attack, they're going to put MI. Peripheral vascular artery disease, deep vein thrombosis, abdominal aortic aneurysm. There's some serious stuff because it's like a balloon of your arteries getting bigger and bigger. And if that bursts, that's, yeah. So you need to keep track of that. Gastrointestinal issues, GERD. I don't know of any military personnel who don't have rough reflux disease. All we eat were those bad stuff, burgers. I don't eat land animals anymore for good reasons. I ate enough. I think I've eaten every part of the animal in Jamaica and stuff. So I'm good. Somebody said, oh, you don't do land animals, only sea animals. I'm like, yeah, something like that. So, golden nuggets, go through and pull out all of these stuff. If you have diabetes or pre-diabetic, if you're pre-diabetic or anything that show your glucose number was in that pre-diabetic range, that's why you have to know your labs. What's pre-diabetic? Hemoglobin A1C, you have to look at those numbers as well. So you won't know if you're diabetes or, if you have irritable bowel disease or irritable bowel syndrome or nausea, vomiting. These are just some of the stuff you need to look for in your records. And I just know all of y'all here have reflux disease. Y'all eat some greasy fries and then you feel that chest burn, right? Is that listed anywhere? Right? Okay, I'm being good. Here's some diamond nuggets that you don't want to miss out on now. So, did you drink alcohol? If you drink alcohol during your time, you're at risk for getting hypertension, coronary artery disease, cancer of the breast, mouth, throat, esophagus, voice box, liver, colon, and rectum. Yes, alcohol. Learning and memory problems, and much more. So you can't have anything that you can't link back. I don't know. When I was a teenager in the military in 1920, we used to hang out with the dudes, play spades, and thank God I didn't smoke. I think I tried a cigarette one time and my chest burned for like a whole week. And I'm like, I'm not touching that stuff ever again. And then I try to run and I can't breathe. I'm like, I don't subscribe to that. So, but I did have my Mad Dog 2020 night train hanging. We were 1920. It was what we could afford. But if you have something like fatty liver or something, you won't know if you never had a CAT scan of your abdomen, right? So you have to think about the diseases that are associated with drinking. Do you have any of those? Right? They have the Officers Club and the Enlisted Club. I know they serve alcohol in there. Hello. They don't just serve Coca-Cola. All right. So if you smoke, lung disease, that's the COPD, heart disease. Again, all sorts of cancer, which is my specialty right there. COPD, diabetes, and much more. So those are the diamond nuggets I'm leaving with y'all. If you have any of those things and you did any of those things in the military, you need to go in and check about that. Gestational diabetes. Sometimes you get gestational diabetes. It's usually temporary. However, once you have gestational diabetes, it sets you up for having diabetes in the future. Yeah. All right. Evaluating your pain. This is one of the biggest mistakes that we all make. And I used to make this mistake too when I was enlisted. I became a physician, and I changed based on my frustration in dealing with the patients, because they'll try to explain their pain to me, and it just, one scale of 1 to 10, what does that mean? So this is the biggest diamond of them, because you all have pain. This is the biggest diamond of them all. If you're being evaluated for your pain, make sure you use the Smiley Face Pain Scale. Don't just guesstimate, because a lot of time you guys are like, oh, I'm about a 4 on my worst day. Do you know 4 is just like, look at 4, just a boom. Okay. So you have to be honest about your pain and consistent, right? So no pain, pain-free, you're laughing. And if you're saying, oh, my pain is 3 to 4, there's no rating associated with that. That's not pain. That's probably just gas or something. So be honest. And whenever someone is evaluating you for pain, ask them for the patient pain scale with a smiley face. And if you're in pain, you shouldn't be having any of these greens. So it's no way you're in pain and in the green area, right? So it's either yellow or up. And that if that's the only thing you take away, it would have been worth your time today. The pain scale is important. No guesstimate of 1 to 10. You ask them to see the pain scale, please. All right. So another big thing for me, I'm getting there, the disability rating by system. Ladies and gentlemen, ladies, the VSO, most of them are males, and nothing against them, but they're not going to talk about some of the private stuff that you're dealing with. If you look in your record and you see this metorrhagia, like, what is that? Is that monthly thing that's pretty heavy. And that also has a disability rating associated with it. If you had to have a hysterectomy because of it or any sort of female issue, you want to make sure that's addressed. Likewise for the male. If you are going through prostate problems or any sort of cancer, erectile dysfunction, anything in those areas, the uncomfortable topics, I deal with cancer stuff. So we talk about this all the time. And this is my comfort zone. I have no issue with this. It's part of the body's medicine is what I do. So you want to be sure to discuss, you have children and then you're urinating on yourself and leaking, or gentlemen, you're having leakage. You need to bring that up. Does the gestational diabetes hold for a possible rating only if it's diagnosed while pregnant? I'm not quite sure I understand that question. Well, gestational diabetes usually is diagnosed when you're pregnant. They don't have a gestational diabetes diagnosis outside of pregnancy. So if you are diagnosed with gestational diabetes during any part of your pregnancy or shortly thereafter, it resolved. And then later on, after you get out, you can then have diabetes. Then you could link it back to why you were in the military, right? So hopefully that answered your question. All right, the disability benefit questionnaire. This is a DBQ. I'll be sending you, I'll download it for you as well. Does the gestational diabetes? Got it. Thanks. Okay. So for the disability benefit questionnaire, I remember when I went in the first time, because I think when I was getting out, I went to that exit thing you have to do like a year and a half out. I went to it like 3 times. And the first time I went, they just throw you this DBQ and wanted you to turn it in. I'm like, no, I'm not going to you just show up and they want you to fill out this like 8-page stuff about the issues that you're having. But that's like, no, you will not be getting this from me today. I'll be coming back, because if you're doing your homework, you would have had stuff already written down, right? If you have elbow issues or wrist issues or health and wellness, tobacco use or vision issues or eye disorder. I just said some of this I can't remember. I wrote it down elsewhere. And that's the thing about doing your homework. They'll try to just throw this on you and be like, oh, well, you have issues. You remember. I go to the doctor myself sometimes and have to take a picture of what I'm on vitamin D and I'm taking multivitamin and what's the dose again? I want to go over this DBQ and know what it's about. So let me go forward here. So again, see, laying out, just tired, busted up, M16, fingers, I've been shooting too much. So the PACT Act is fabulous because it's a presumed diagnosis. No medical record, just your orders that show you were at these locations that they're talking about with the presumed diagnosis. And you're having issue and illnesses that are associated with them. You must go through all of your records yourself, lovely ladies and gentlemen. Yourself, please. You have to go through it. Don't depend on anybody else to do this for you. You do your homework and then you go be with them to get the information done. The burden of proof for other diagnosis is on you. So let's see now. I'm wrapping up here and I think I wanted to give you, So the VFW went before Congress and was talking about the VA claim sharks are increasing. So watch out. People will charge you hundreds and hundreds of dollars to go through your records and guarantee that you're going to get this percent and that percent. No. Do your own work, y'all. Go through the VSO. Now, like I said, they're not all created equal. But if you do your own homework and go through VSO and stuff, then yes. People have been asking me to do at least a group stuff and they'll pay something, whatever. I'm like, I don't know. I just do the medical portion. I don't want you to feel like, okay, this is something that I do. No, I just try to help you understand some of these medical stuff that's in there. But be careful of this VA claim sharks and then guarantee you your percentage is going to be increases. This was brought before Congress recently. So just be aware of that. And exiting. Can you believe this? This was me here when I first joined. Little old teenager girl there trying to get my muscles on. Private ROTC back when I was playing basketball for West Point Prep School. Then opening the clinic out in Virginia. This is definitely dedicated to my mom and my dad. I thank them for having me. I lost my mom last year. So I know I pampered her. So love on your parents, love on your mother. I totally miss my mom so much. I know she's up there looking down on me, but she always prayed for me by name. So I know I'm blessed now because of her prayers. Graduating from medical school over here and retirement, the most beautiful thing of all, retired Lieutenant Colonel. Praise Jesus. I couldn't wait to get out my 24 years, but it was combined enlisted and officer. So thanks, Mom, for having me. Love you, Dad. So your review is important to me. And so I would love to hear how this was for you. So if you could take a moment and give me your review. I'm a learner for life. I'd love to know how this was beneficial to you. There was some glitches, but we got through it. I did the Army thing. I just run right through. Just a glitch. Got it. So if you could please give me your review. Your input does matter to me, and your rating. I do a lot of this on my own. It's my own little separate business. I don't do Shark. I just help people do advocacy work, mostly in the cancer arena. And lately, folks have been asking me to go through this VA stuff with them. Again, my disclaimer, I just do the medical portion of stuff and pick stuff out that they may have missed. So for my time, I typically charge something that's reasonable, but it's not my forte. So I keep that very small. And I think it's been an hour. So you may find me, I'm just now getting back into social media. I stayed off. So you can follow me on Facebook. I'm Queen the Maven. On Facebook, Instagram, I'm there at Queen Quanta. I have my YouTube channel will be coming out soon that I'll do some of this health information about. Is there any question before I go? You're most welcome, Kenny. You're welcome, Celso. You're welcome, Ricky. You're welcome, David. You're welcome, Tarek. Any questions before I go? Well, let me stop sharing here. And again, this was just birthed out of my frustration and the, what? Are you kidding me right now? Kind of deal with my own experience. And I just think, what do my brothers and sisters who have no medical knowledge have to deal with? So please follow me on social media. So in respecting your time, I'm going to go over here. Are there any questions or anything else before I bid you all good night? You're welcome, William. No problem, Arlene. Happy I could help. You're welcome, Irma. Any other questions? And I know, I received an email that one of my buddy that I knew from high school in Jamaica. Oh my goodness. Big shout out to my Merle Grove High School buddies that are on here. My goodness. Yes, indeed. Thank you so much for joining. I don't want to put your name out there if you don't want to be known. as to who you are. But can you imagine that? From Merle Grove High School in Jamaica, I graduated high school before immigrating here. So thank you so much. What about the NARSM and the Nexus letter? Any recommendations on that? I'll have to look into that for you separately. But that's a little bit more deeper here. I'm just trying to get your foot in the door. Go Merle Grove. Yay. Any other questions, y'all? I'm going to bid you good night in 1 more minute. Any other question? Okay, I see a Q&A here. So thank you so much. This helped me out, and I am even more educated now, and I work for the VA, so I can definitely help my veteran out even more. Oh, awesome. All righty. So welcome, Lauren, Pops. God bless you too. You're most welcome. I just want to say thank you all for joining me. Y'all are most welcome. Until then, may the Lord bless you and keep you and cause his face to shine upon you and bring you peace. Queen, signing out. Bye, y'all. Take care and God bless.